simple exercise. And then sometimes we have fun with it. Let's do ha. Come up off the heels, deep breath. Ha. Ha. Again. Ha. Now let's do a flyaway out to the side. Ha. And the other way. Ha. Two more. Ha. Last one. And ha. Good. All right, ready to go? Tai Chi Cha, for those who want to know.
Day for us, and we're so pleased you could come and share it with us. We have a very short program, and I'd like to begin by acknowledging some of our special friends and honored guests who are with us today. First, I'd like to begin by acknowledging one of the reasons we're all here today, Mr. Shirley Garrison and his family. We have the pleasure of having some of Shirley's family with us today. We have his daughter Pam from Austin, and right up front, and his sister Paula Wright-Key, and we appreciate their support. And we're sorry that Bill and the rest were not available. And we also have our, tell me your name again. Another Wright, an Amarillo Wright, who's also on the foundation board and joining us here today. So we're excited about that. We have some of our regents here. Wendy Sitton, I believe, is in the back somewhere. We are pleased to have the interim chancellor of the Texas Tech University System, Dr. Donald Harrigan, who will speak to us a little bit later. Also the president of TTUHSC, M. Roy Wilson, who will also make a few comments. We're very happy that the foundation board, the Texas Tech Foundation board, got on the magic bus and came all the way down to the facility. We hope it will represent the face and the personality of the Garrison Institute to the residents of West Texas. The Garrison Institute has a research component which is located still at the Health Sciences Center campus, but our administrative offices and clinical outreach will be located here in this building. So we're very excited, and we're hoping that with time people begin to recognize the Garrison Institute in ways that other organizations have evolved. I know many of you, when you think about cancer and cancer treatment, you think about MD Anderson in Houston, and we're hoping with time, when people think about aging, whether it's healthy aging or diseases associated with age, we'll think about the Garrison Institute as a place for information and support and help. So we're very excited about having this place open and providing that face and personality for the Institute. When I came here 2 years ago, I found a lot of talented and committed people who saw the need for developing a comprehensive institute that would bridge the gaps of research, clinical, and education in aging, an area which really hasn't been well studied, and it was a gap, I think, in West Texas, and I would say throughout the state of Texas, to have a place where it would all be integrated. A lot of the early founders of the Institute had vision, ambition, worked hard. Mr. Glenn Provost is here. Dr. Randy Schiffer, unfortunately, is out of town. The deans of the 4 schools at the Health Sciences Center, I think Dr. Green may be here from the Nursing College, but all of them were very instrumental in getting the vision organized for developing the Institute, and for them we are forever grateful. But I have to say that the face and the personality of the Institute, when I came 2 years ago and it exists today, is really still defined by one person, and that really is Shirley Garrison. And many of you know Shirley. He's been a prominent member of Lubbock and the West Texas community for a long time. And many of you may also know, I'm sure likely know, that his wife Mildred has Alzheimer's disease, and Shirley's been very public about that. And I think what's remarkable about Shirley is that rather than asking the question that I think we would all ask when we have a personal family tragedy, you would say, why me, why my loved one, why my family? Shirley took the opportunity to say, this has happened to us and our family, but what can we do to help others? How can we provide help for the future generations so that the scourge of Alzheimer's disease and other diseases of aging might be prevented? How can we help those who are here and their families today? And it was his vision and his gift to take that adversity and give us the Garrison Institute that I think we will be forever grateful. And if we had Glenn up here, I'm sure he is more erudite than myself, would have a quote from some great thinker. But for those of you who have heard me speak before, you know that most of my quotes are derived from Disney movies. So, but I have one that I think is particularly appropriate for Shirley from the movie Mulan. And that is, the flower that blooms in adversity is the most rare and beautiful. And I think to take the adversity of the tragedy of his personal family and give us the gift of the Garrison Institute is truly a wonderful thing. And I hope that over the years we'll be able to repay that kindness in some small way through the research, clinical, and educational efforts of the Institute.
Alzheimer's disease is an irreversible progressive brain disease that destroys memory and thinking skills and impacts millions of family members, friends, and caregivers annually. And whereas healthcare leaders in Texas are facing significant challenges created by the rapidly aging population, as 1 in 10 people over the age of 65 and nearly half over the age of 85 are affected by Alzheimer's disease. And whereas aging and the study and treatment of neurodegenerative disorders, including Alzheimer's disease, is a strategic priority for the Texas Tech University Health Science Center. And whereas Mildred and Shirley Garrison have generously supported the Health Sciences Center's Aging Initiative by building the Garrison Geriatric Education and Care Center, establishing the Garrison Endowed Professorship in Geriatric Nursing, creating the Garrison Endowed Chair in Aging Sciences, and founding the Garrison Institute on Aging. And whereas the Garrisons have been instrumental in research efforts to discover the underlying causes of Alzheimer's disease, to improve treatments and care for Alzheimer's patients, and to offer educational opportunities to students, healthcare professionals, and the public. And whereas it is appropriate for the City of Lubbock to recognize Mildred and Shirley Garrison for the compassionate support they have shown and for the legacy they will leave for aging research, education, and healthcare services for seniors and families affected by Alzheimer's disease in West Texas and our nation. Now therefore I, Mark McDougall, Mayor of the great city of Lubbock, Texas, do hereby proclaim the day of May 4th, 2006 as Mildred and Shirley Garrison Day in Lubbock, Texas, and we encourage all citizens to unite with the Garrisons in their commitment to supporting the Garrison Aging Institute on Aging and its efforts to create a more promising, healthy future for the aged. In official recognition whereof I affix my signature and it's signed on May the 4th today, Mayor Mark McDougall. Mr. Garrison, thank you so much.
Well, it's welcome to all of you here today. I'm happy to be here, and I want to say before I begin my little talk that Glenn, appreciate you making an effort to get back here, because I saw him off the other day and he was headed to Lido Bay, and I don't know how he got back. But in that regard, I would like to acknowledge and say that I remember who started this institute, and it was a couple of years before we arrived, and I'm not sure that she's here today, Dr. Lynn Bickley and Dr. Randy Schiffer, and Glenn, I think, gave the birth to this institute. So I wish you could hear from them. I would like to thank Commissioner Jim Gilbert for proclaiming this the Mildred and Shirley Garrison Day in Lubbock. This is a very special honor for me and for us, and I would also like to thank my family and friends for being here today and to share this experience. Mildred and I are pleased that we have been so blessed and are able to be a part of building this institution. We are confident that the Institute will continue to grow and move forward with innovative research and education programs to help people with Alzheimer's disease and other aspects of aging. As many of you know, Alzheimer's disease is a particular concern to our family. We are proud of our relationship with the Garrison Institute and its important work to improve the lives of patients and their families afflicted with this terrible disease. Again, I would like to thank everyone for being here and express how much I appreciate your support for the Garrison Institute on Aging. Thank you. Thank you very much, Paul. I appreciate you and your staff.
You're going to tell Good.
Like a crazy clown, and I don't feature what you're putting down. Since I kissed his golden lips of wine, the thing that bothers me is that I like set me free. Stupid Cupid, stop picking on me. Crazy clown, and I don't feature what you're putting